What is acute respiratory distress syndrome? Acute respiratory distress syndrome, ARDS, is a type of respiratory failure characterized by rapid onset of widespread inflammation in the lungs. What does acute respiratory distress syndrome feel like? Common signs and symptoms include shortness of breath, fast breathing, fatigue and general weakness, low blood pressure, a dry, hacking cough and fever. What causes acute respiratory distress syndrome? There are direct and indirect causes. Direct causes include pneumonia, including bacterial and viral, aspiration, inhalational lung injury, lung contusion, chest trauma, and near drowning. Indirect causes include sepsis, shock, pancreatitis trauma, for example fat embolism, cardiopulmonary bypass, burns, increased intracranial pressure. Is acute respiratory distress syndrome curable? Yes, but death rate has high. The primary treatment involves mechanical ventilation together with treatments directed at the underlying cause. The syndrome is associated with a death rate between 35 and 50%. Is acute respiratory distress syndrome painful? ARDS may be accompanied with pain, but it is not main clinical sign at this case. How is acute respiratory distress syndrome diagnosed? ARDS is diagnosed according to 2012 Berlin definition. Lung injury of acute onset, within 1 week. Bilateral opacities on chest imaging. Respiratory failure not explained by heart failure or volume overload. Decrease the ratio of partial pressure arterial oxygen and fraction of inspired oxygen. Is acute respiratory distress syndrome obstructive or restrictive? Adult respiratory distress syndrome, ARDS, is restrictive disorder, because it is characterized restriction in the lungs, difficult inspiration. Is asthma acute respiratory distress syndrome? No, asthma is not ARDS. Asthma is a chronic disease involving the airways in the lungs. It is characterized by variable and recurring symptoms, reversible airflow obstruction, and easily triggered bronchospasms. How to prevent acute respiratory distress syndrome? There is no one measure you can use for prevention of ARDS. Many times it depends on causative condition. There is ongoing research on the treatment of ARDS by interferon beta 1A28 in preventing leakage of vascular beds. Early phase trials showed an 81% reduction in odds of 28-day mortality in ICU patients with ARDS.